While you were sleeping, your body was quietly preparing for a battle, and most people wake up and make it worse before they've even had breakfast. Research suggests that the early morning hours are among the highest risk windows for heart attack and stroke. Not because sleep is dangerous, but because of what happens the moment your body wakes up, and what so many of us do in response. Today, we're going to walk through the most common morning mistakes that may be quietly pushing your blood pressure higher, and what to do instead, starting tomorrow. By the end of this video, you'll understand exactly why blood pressure tends to spike in the morning, which everyday habits may be making that spike worse, and the simple shifts that may help support healthier readings throughout the day. No extreme advice, no overwhelming changes, just clear information that finally makes sense, and small steps you can actually take. Let's start with what's happening inside your body right now. Every single morning, the moment before you open your eyes, your brain sends out a signal. It floods your system with stress hormones, mainly cortisol and adrenaline. These aren't doing something harmful, they're doing their job. They're waking up your heart, tightening your blood vessels slightly, and raising your blood pressure, so you have the energy and alertness to start your day. Researchers call this the morning blood pressure surge. It's completely natural. Almost everyone experiences it. But here's the problem. Think of your blood vessels like a garden hose. In a healthy system, that hose is flexible, wide, and handles the morning surge easily. But when blood pressure has been elevated for months or years, that hose becomes stiffer and narrower. The walls are already under strain. Now your body adds the morning surge on top of that. Suddenly, you have a system that's already under pressure, being pushed even harder. That's why mornings carry extra cardiovascular risk for anyone managing high blood pressure. And it's why what you do and don't do in the first 60 to 90 minutes of your day matters more than most people realize. The surprising part is, most of the things people do to wake up can actually make this worse. Let's go through them one by one. The first mistake catches people off guard because it usually happens when things are going well. They check their blood pressure, the numbers look great, and they think, maybe I don't need this medication today. Here's how to think about that. Your blood pressure medication is like a security guard. Just because the building is quiet doesn't mean you should send the guard home. The reason it's quiet is because the guard is there. When you skip a dose or shift the timing without guidance from your doctor, you may be removing that protection during the exact moment your body is already pushing pressure higher. And for some medications, this can create a rebound effect, where pressure climbs even higher than your baseline. If your readings have been looking good, that's the medication working. That's not a green light to stop. As always, never stop, skip, or adjust your blood pressure medication without a direct conversation with your healthcare provider, especially if you take it in the morning, especially during that critical surge window. The second mistake happens at the kitchen table, and it's one most people never connect to blood pressure at all. Sodium acts like a sponge in your bloodstream. It pulls water into your blood vessels, increasing the total volume of fluid your heart has to push through. More fluid, same size pipes, more pressure. The problem is, many normal breakfast foods are quietly loaded with sodium. Processed cheese, store-bought bread, breakfast meats like ham or bacon, even that grab-and-go pastry from the bakery counter can contain nearly half your recommended daily sodium before you've eaten anything else. Research suggests that breakfast built around whole, minimally processed foods, things like oats, eggs, fresh fruit, plain yogurt, or unsalted nuts, may help support more stable blood pressure through the morning hours. Reading food labels helps here. The number to watch is milligrams of sodium per serving, and the serving size matters. It's easy to eat 2 or 3 servings without realizing it. One salty breakfast won't cause a crisis. But combined with the morning surge that's already happening, it's one more layer of pressure your heart has to manage. Here's one that surprises almost everyone. You've just gone 7 or 8 hours without drinking any water. While you slept, you lost fluid through breathing alone. That means you wake up mildly dehydrated every single morning. When you're dehydrated, your blood becomes slightly thicker, more like syrup than water, and thicker blood is harder for your heart to pump, which means your heart has to work harder and pressure can rise. One of the simplest things you can do for your blood pressure each morning is drink a full glass of water before anything else. Before coffee, before food, it helps thin the syrup, supports kidney function, and may ease some of that early morning cardiovascular strain. Now, about that coffee. Caffeine is a stimulant. For many people, it causes a temporary rise in blood pressure, usually peaking within 30 to 60 minutes. That effect can be amplified when you're already in the middle of a morning surge, and when coffee hits an empty stomach, absorption is faster. For most healthy adults, moderate coffee consumption hasn't been linked to serious harm. But if your morning readings consistently run high, it may be worth discussing the timing and amount with your doctor. Some people find that waiting an hour before their first cup, or having it after food, makes a noticeable difference. Herbal teas like hibiscus or chamomile are caffeine-free alternatives that some research has associated with mild circulation benefits, worth exploring if you're looking for options. For anyone who smokes, and especially those who reach for a cigarette within the first few minutes of waking up, this one is important. Nicotine causes your blood vessels to constrict immediately. It's called vasoconstriction, and it raises blood pressure quickly. Doing this during your body's natural morning surge is like trying to squeeze a garden hose while the water is already on full blast. It creates significant stress on your cardiovascular system at the worst possible time. If quitting feels out of reach right now, even delaying that first cigarette by an hour may reduce some of the immediate morning strain. And when you're ready to take that step, talk to your healthcare provider. There are more options available now than most people realize. If your doctor has recommended monitoring your blood pressure at home, the way you take the measurement matters just as much as when you take it. Common mistakes can shift your reading by 10 to 20 points in either direction. That's not a small error. A 15-point difference can change how you interpret your numbers entirely. A few things that can skew readings: having a full bladder, crossing your legs, talking, checking your phone, measuring immediately after exercise, or using a wrist monitor instead of an upper arm device. For a more accurate reading, use the bathroom first. Sit quietly with your back supported for at least 5 minutes. Place your arm at heart level and take 2 or 3 readings 1 minute apart. Accurate monitoring gives your healthcare provider a true picture of what's happening, which is what guides your care. Measuring incorrectly can create unnecessary anxiety, and anxiety raises blood pressure. This one is brief, but important. If you wake up and notice a persistent headache, blurred vision, dizziness, or unusual pressure at the back of your neck, don't dismiss it. These can be signs that your blood pressure has risen significantly. If you have a home monitor, check it. If the reading is elevated, especially at or above 180/120, contact your healthcare provider promptly or seek urgent care. Don't explain it away as just bad sleep or probably stress. If you have a history of high blood pressure, your body knows how to ask for help. It's worth listening when it does. High blood pressure can feel like a shadow you can't shake, but it doesn't have to control your mornings or your life. Your heart is resilient, and it responds to the small, consistent things you do every day. If you've been looking for a clear starting point, a structured, step-by-step plan built around real daily habits, that's exactly what we designed the 30-day blood pressure reset foundation for. It's not a miracle cure. It's a foundation. DASH-inspired meal plans, beginner walking routines, simple resistance exercises like wall sits and planks, and a daily structure that makes healthy habits feel manageable instead of overwhelming. It's built for beginners, it's built for real life, and the link is in the description below if you'd like to explore it. No pressure, just an option. When you're ready, you don't have to be perfect, you just have to be intentional. Tomorrow morning, start with a glass of water, take your medication as prescribed, and give yourself 5 quiet minutes before the day begins. That's it. That's the foundation. Your heart is working for you every second of every day. Small, consistent steps in return are how you support it. If this video helped something click for you, consider subscribing to Heart Strong Lab. We cover blood pressure, heart health, and longevity topics, explained simply without the confusion. Small steps, consistent days, that's how meaningful change happens. We'll see you in the next one.